Myself, Dr. Tanima Singhal, and I welcome you all on today's session. So let's start the Q&A. If you have any questions, you can put it in the chat box. I'll answer it. And just waiting for few moms, and we'll start taking answer questions, which you all have filled in the Google form, and then we'll take the live questions. So first question is from Sivapriya, low milk supply. So first of all, Shivapriya, if you are facing low milk supply, then we need to work on few things. Like first is creating demand. So if your baby is already coming on the breast, but you are still depending on formula to increase her weight, then after every feeding session, just try to pump and also try to frequently breastfeed the baby. Second thing is also work on your hydration. Next is to improve the flow, do oil massage and warm compress. Keep your baby skin to skin with you. Take galactogogues like lactomagic powder and Morico tablets. Next thing is keep a track of baby's weight gain and baby's formula intake. All these steps will help to improve your milk supply. If you are a mother who has not tried different things and are looking forward for first time help into this, then try these tips for 1 week and see. If it works for you, it is very good. If not, then you just reach out to the team and get your consultation done so that you get a proper customized protocol as per your requirements. Next thing is about that if your baby is not at all coming on the breast, then you need to create the demand by doing the pumps, and the other process will be the same. So this is the way of improving the milk supply. Next question is from Alekia, insufficient breast milk. Already answered. Ruchi, latching and low milk supply. So if for low milk supply, I have already answered regarding latching issues. So if your baby is not at all coming on the breast and crying even on seeing the when you're just unbuttoning, then that means the baby has developed breast aversion. In this case, what you need to do, you just like don't push her into direct breastfeeding, or don't push your son or daughter into this. Keep your baby skin to skin with you for every, like whenever you're burping the child. That will have a positive affinity between you and your child. Don't just push the breast in the baby's mouth, because that is very difficult for them to feed the breast, specifically if you have already, like they already have been bottle feeding. So now if you want to get a positive affinity, keep the baby skin to skin with you instead of pushing the breast in the baby's mouth. For latching techniques, you need to follow, if your baby is not latching properly and if you're having like a pain in the nipples and all that, then you need to follow the deep latching techniques, where you need to hold the breast from U shape from below, from the side where you are planning to breastfeed. Hold the baby from the other breast, and then with the wrist movements, extend the baby's head. The chin should touch the mother's breast. Then tickle the nipple on the baby's upper lip. The baby will open a big mouth, and then you latch the baby. This is the proper latching technique. Next question is from Aneri, painful and ineffectively in latching. So painful and ineffective latching will be always when the baby is doing a shallow latch. So I've just shown the technique, just you can work on that. Dr. Himanshi, no milk supply and latching difficulty. I have already answered. Mayuri, low milk supply issue, already answered. Nazra Ashad, breastfeeding issue, baby is not latching, already answered. Tasneem, low milk supply, already answered. Manisha, my baby is 5 days old now. He isn't sucking my breast. We have to give formula to feed. Your baby is just 5 days old now. So you can definitely get everything back on track and get the baby on exclusive breastfeeding. What you need to do, every 2 to 3 hours, try to breastfeed the baby. If the baby is not coming on the breast, then you pump. But your breastfeeding trials have to be done for every demand feeding. And for 5 days old, basically the demand, because the baby will keep sleeping for long. So that's why try to feed the baby every 2 to 3 hourly. Next question is from Avneet. I have a 6-day baby girl via C-sec. I have sore nipples and milk is coming in drops. Is it sufficient for the baby? As in daytime she feeds and sleeps, but at night even after feeding she seems hungry. What to do? So first of all, see the weight gain of the baby. Your baby is just 6 days old. So till 15th day we want the birth weight back. First 10 days the baby will lose the 10% of the birth weight. Or by 15th day the baby should have the birth weight back. After that, it should be 200 grams per week. So first, right now, have the weight gain checked at your home. and see the weight gain. If the weight gain is going fine, then you don't need to worry about the milk flow and all that. Krishna Priya, no milk supply, already answered. Jyoti, my baby is latching not very properly. I am 2 months, one day breastfeeding. How do I give? I'm not able to understand, Jyoti. Write your question properly. Ruxana, my baby refuses to latch during her sleep but also cries at the same time for milk, keeping her eyes closed. I tried to breastfeed her but failed every time. I am forced to feed her with bottle, sometimes breast milk if available, and sometimes formula milk. I want to extract more milk so that I can feed her during the night. So, what you need to do, because she is not feeding properly, so the demand is not happening. So, every time she demands milk, you try, but don't push her long like 10, 15, 20 minutes. Try for 2 to 3 minutes or maximum 5 minutes. If she's not coming on the breast, then you need to pump after that. But direct feeding trials you have to give every time, and then follow the other methods which I have just shared right now to increase the milk supply. Follow for 1 week and see. If the milk supply is improving, very good. If not, then just reach out to us, get your consultation done so that you get the best results out of it. Srishti, baby is not taking breastfeeding. He takes for 3 minutes, then leaves and starts crying. So Srishti, okay, this if this is happening, then what we need to do for every demand feeding, if the baby is staying for 2-3 minutes and then starts crying, then for every demand feeding session, just first try on one breast, then you give some small amount of milk and then try the baby on the other breast. Then give obviously the baby is still hungry, you give the milk to the baby and then you pump both the breasts. We need to work on creating the demand, Srishti, because if the baby is feeding only for 2 to 3 minutes, the breast will not get emptied. And you can check this. After 2-3 minutes of breastfeeding, if you check the color of the color of the milk will look thick white. That means the baby has not emptied the breast. So every time your baby is crying for milk, you take the baby on the breast, let the baby stay for 2-3 minutes, then you pump your breast. So this way you need to keep creating the demand along with following the other methods like water, hydration, galactogog, skin to skin, and also keep a track of baby's weight gain and baby's formula intake. This will help you to understand what are the milestones and accordingly just keep moving into this. Okay, so I don't see any new questions. The questions which were there in the Google form, I have already answered. So I think that's all for today. There are no new questions. If anyone who has any question, you can just put it in right wait so that I will wait. Otherwise, I'm just ending this session for today. I hope there are no new questions. If there are any, just let me know. I'll wait for you. Okay, so I don't see any new questions. So that's all for today. If you have any questions, you can just join next Friday. We will have the sessions and the form for the session is always circulated in the groups. You just need to fill that form so that we get your question and we can answer it on the Friday Q&A. Srishti is writing, my baby's birth weight was 2.5, 2.4. Now he's 4 months old. What should be the weight gain now? Just a minute. So 2.4 was the birth weight. By 3 months, we need 2.4 more, 8, 4.8 at 3 months. And now he's 4 months, so 1 month more. So 155, see, 600, 6, 8, 9, 10, 11, 12, 13. 5.4. This is the ideal weight, but a range of between 5 to 5.4 will be enough, Srishti. What is the weight now? Have you checked? 5 to 5.4? 5.6. Very good. So, but right now the weight gain is little more. I wanted 5.4. It is 5.6. So whatever amount of formula milk you are giving, start reducing 5 to 10 ml per feed. This will help you to know where you are heading and start it like keep reducing the formula every week with it. Okay. 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 Okay, Srishti and everyone. I see some others here. So take care, everyone. Okay, Namrata. Hi, ma'am. I checked my baby's weight today. It is 6.8, 3.5 month old. What is the birth weight, Namrata? Tell me that so that I know I need to calculate. 2.4. So 2.4 was the birth weight. At 3 months, we need 2.4 more. So 4.8. 7. So 2.77, I take it as 2.8. 2.8 and 2.4, 8, 9, 10, 11, 12. 3.5. So 600. Sorry, 300 more. So it should be nearly 4.5. What is the weight now? 6.8. 3.5 months. How come? 2.77 was the birth weight. So I take it as an average of 2.8. Okay. Then we should target at 200 grams per week. So till 12 weeks, that is 3 months. 12 to the 24, 2.4. So 2.4 and 2.8, it should be 8, 9, 10, 11, 12, 2, 3, 4, 5, 5.2. And 5.2 and then add 300 grams more for 3.5. So 5.5. But the weight is 6.8. Namrata, are you giving formula also? How many times you are giving? Okay. And you're directly feeding and pumping also? Okay. So right now the progress is good. So I want you to reduce formula slowly. Start reducing 5 to 10 ml per feed because the birth weight was little lesser side. So we need, it's okay, but we should not depend on formula to increase the weight. Start reducing 5 to 10 ml per feed and keep tracking the weight. If the weight gain is good, even after dropping the formula, it's good. Keep moving with this, Namrata. It's a good progress. Keep moving, Namrata. Okay? Welcome. Okay, girls. Thanks a lot for this amazing session. You're most welcome, my dear Sashti. So just keep moving, girls. And if you ever feel that you are feeling lonely, you're not able to get the results, come to these Friday Q&A sessions. We'll discuss, we'll see everything, and we'll have we'll have a chat, we'll have a discussion, and you be a confident mother. That is more important. Okay? Chalo. Take care. Bye. This is great, Namrata. You're most welcome, my dear. Okay, girls, take care. See you next week. Bye-bye. Bye.